Hello, I'm Dr. Rich Sinda, and tonight we're going to talk about dementia and the exciting things happening in that world. A very appropriate quote is, "You never change things by fighting the existing reality. To change something, you build a new model that makes the existing model obsolete." This is a very pertinent quote, and you'll see later on that this is exactly what is happening and what needs to be done with our approach to Alzheimer's. Tonight, we're going to talk about the impact that Alzheimer's has on our society, the current standards of care and why they need to change. We're going to talk about new insights from integrative medicine and research. We're going to talk about amyloid plaques and the role that they play in the development of Alzheimer's. We're going to talk about finding opportunities to help treat and prevent Alzheimer's. We're going to talk about the goals of treatment, and then we're going to go over some patient cases. So over 5.8 million Americans over age 65 are affected by Alzheimer's in the United States. It's projected to be over 14 million by 2060. The estimated total healthcare costs in 2020 were $350 billion. With Alzheimer's, you get loss of memory, loss of identity, loss of social interactions, loss of enjoyment of life, and we really lose ourselves or we lose the loved ones in our lives when this happens. So it's devastating both economically and socially. The current standard of care involves cholinesterase inhibitors, which block the breakdown of neurotransmitters that your brain cells use to communicate with each other. Namenda or memantine, which is a drug that blocks another type of receptor. Brain cells that are suffering from Alzheimer's are excitable, overly excited. This tends to calm them down. And there's a new drug that you might have heard of this year that was just developed or just approved called aducanumab or Aduhelm. Didn't show any real effectiveness in Alzheimer's. It was approved anyway because they're so desperate, and you'll see why soon in my talk, why they're so desperate. 3 people actually left the FDA in protest because they didn't agree with it being approved. And basically supportive care, where you, in essence, get your affairs in order and get ready for all the nursing care that you're going to need. And this is the current standard of care. Just to show you that where we're going to go to here in a little while didn't really come out of nowhere. For a while now, we've been getting clues from integrative medicine that there are potentially reversible causes of dementia, including medications, prescription medication causes, vitamin B12 deficiency, hypothyroidism, sleep disorders, normal pressure hydrocephalus, which is excessive fluid in the brain, chronic subdural hematoma, which is a bleed inside the brain tumors, and infections of the brain. Those are all things that we've known for a while that cause reversible dementia, and Dr. Bredesen basically just built on this, which we'll talk about shortly. So Dr. Bredesen is a neurologist from California. He trained at some of the most prestigious institutions in the United States. He started at Caltech, went to Duke for med school. He did a residency in neurology out in California. Then he did 30 years of dementia research. Mainstream doctor the whole way. At one point, he realized that no one drug is going to be able to fix Alzheimer's. So he set about looking for other mechanisms that cause Alzheimer's and ways that we could actually jump in and make a difference. In his 30 years of research, him and his team, he found that there are really 6 main root causes of Alzheimer's: inflammatory, glycotoxic, which means related to blood sugar abnormalities, deficiency of nutrients and hormones, toxicity related to toxins, vascular issues related to problems with blood vessels, strokes, etc., and trauma, which is related to head injuries and traumatic brain injuries, etc. These are all things that he found that all contribute to Alzheimer's, and many of them aren't even looked for regularly. So what is missing from the current standard of care? They don't check for any signs of genetic problems, They're not looking for inflammatory markers. They're not looking for chronic infections. They're not looking for insulin resistance. They're not looking at hormonal status. They're not looking at potential toxic exposures. They're not looking at how healthy your microbiome is or your healthy bacteria. They're not looking at blood-brain barrier issues, which is basically whether things that don't belong in your brain end up getting through into your brain from your blood vessels. So let's talk about amyloid plaques. And this is really where it all falls down in mainstream medicine. Amyloid is a part of the innate immune system, which means that it is part of the healthy innate immune system, which means it helps us fight off insults to the brain. Whenever there is an insulting culprit, something that's causing inflammation or an infection or a metabolic problem, one of the things your brain does to help fight it off is create amyloid. Amyloid is a protein that usually your body clears once the insult or once the problem is over. If the problem becomes chronic, then you have chronic amyloid hanging around and it forms into plaques, which diminish the health and viability of your brain cells. The things that stimulate amyloid are the things we've talked about: high insulin levels, high glucose levels, inflammation, infection, and toxicity. Those things will all make amyloid stay around, form plaques, and lead to issues with brain cell health. So you have to find the root cause of it or of the problem, or else the amyloid's going to hang around. And if the cause for the increased amyloid isn't found, then the amyloid is problematic. So just finding drugs to knock out the amyloid are not the problem. You really need to get to the root cause. And that's why our current treatments have failed miserably, and why we need another approach, and why we need a new model. So a good way to think about this is, what that Dr. Bredesen and his colleagues have figured out, is that let's say you have a roof that has 42 potential areas that could develop holes. You need to find out where these holes are, then take measures to fix the holes, and then confirm that they are improving, and then monitor the progress. So when looking at the risk of Alzheimer's, you check 42 different parameters. You find out which of those parameters are off with testing. You take measures to fix any of those holes that you find. Then you confirm that you have been successful in treating those, and then you monitor for improvement. So that's what Dr. Bredesen and his team have figured out. So the goals of treatment are improving and restoring insulin sensitivity, replenishing nutrients and hormones that are deficient, treating any toxicity that you find or other sources of inflammation that you should uncover, treat any chronic infections that you find. Shortly, Guy Odishaw is going to talk to you extensively about bioelectric treatment and training, which have found to be incredibly effective as well, especially in conjunction other parts of the program. As with everything, lifestyle modification is crucial if you want to get this program to be effective. You need to improve insulin sensitivity. You need regular and vigorous activity as much as you tolerate it. You need to have high quality and high quantity of sleep, and you need to avoid and remove toxins from your system. So often in people who criticize Dr. Bredesen's program, you'll come across this, but this is the big stumbling block. They are stuck on the idea that there's only one way to assess treatments and whether they're effective or not. And that's the current standard of science, that they use randomized double-blind placebo-controlled studies. Those are incredibly limited when it comes to analyzing multifactorial treatments like Dr. Bredesen has they're really only useful for one drug, one outcome situations. And that's, again, why this has failed over and over and over again. No standard of care drug for dementia has been found to be effective at changing the course of the illness. Any more than one drug, when you get to 2 or 3 factors or drugs involved in the study, analyzing it, the less effective or the less powerful or conclusive the studies are. Now, so you can imagine when there are 42 possible holes in your roof and you have 5 to 7 holes to fix that can only treat with 1 or 2 drugs, and with an incomplete evaluation, by the way, it's really not a surprise that our current standard of care is failing. But when it comes to criticizing Dr. Bredesen's approach, this is where it comes from, and he's addressed this thoroughly. So one of the ways to think about it is we all know people who have transformed their lives and health with permanent lifestyle and dietary adjustments. I know people who have lost 50 pounds and ran their diabetes away and it never came back. I mean, I followed them for 10 years and their diabetes never came back. And, really, truly too, those are the only effective measures for short of bariatric surgery that have been found to be effective for losing weight and being healthier as well. All of those programs and all of those types of self-treatments or lifestyle modifications that those people made would be deemed, unscientific by this standard as well. So now we're going to talk about a couple cases that make it very clear how effective these programs have been. Case number 1 is a 75-year-old female psychiatrist. She's a psychiatrist. She's obviously very sharp. She was her whole career. She practiced many years. She suddenly developed severe difficulty remembering new information, and this progressed rapidly over 2 years. So her husband brought her in for evaluation. That scan showed typical findings of Alzheimer's, hippocampal volume loss at the 16th percentile. It should have been right in the 90th percentile. The hippocampus is the part of the brain that is involved in making memories. Cognitive testing placed her at the 9th percentile for her age. So again, she was likely in the 90th percentile when she was in her heyday at her career. She did not have any copies of the ApoE4 gene, which is the main gene that that increases your risk of Alzheimer's. Her blood test showed very low levels of vitamin D, pregnenolone, progesterone, estradiol, thyroid, and vitamin B12. She was also found to have an elevated homocysteine level, which is an inflammatory marker. She began the recode protocol of Dr. Bredesen's, and deficiencies and excesses were treated effectively. Over a 12-month period, she noted marked improvement. Cognitive assessment increased from 9th to 97th percentile. Her significant other said that her memory went from disastrous to just plain lousy and finally to normal over that 12-month period of time. Her follow-up labs showed marked improvements in vitamin D, pregnenolone, estrogen, progesterone, thyroid, and vitamin B12, and her homocysteine level normalized. So you can see how powerful, just some pretty straightforward. Case number 2 is a 65-year-old female, sharp and successful her entire life, an accomplished distance runner and writer. When she turned 60, she began to note severe problems with focus and memory. Her father had died from dementia, which was proven to be Alzheimer's on autopsy. Genetic testing showed that she had 2 copies of ApoE4, so her lifetime risk of developing Alzheimer's was 50 to 70%. Her lab testing showed marked elevations of her homocysteine level as well, just like the last case, which is a marker of inflammation. She began the recode protocol, and within 3 months, she noticed marked improvement. After 6 months, her homocysteine level had only dropped to 11. She was then changed to more effective forms of vitamin B12, methylcobalamin, folate, methyl tetrahydrofolate, and vitamin B6, P5P. And her homocysteine came down to 7, which is in the optimal range. After 4 years on the protocol, she remains mentally sharp and had an amyloid PET scan that was totally normal. didn't show any loss of hippocampal volume. These are a few books that I would highly recommend that will introduce you to Dr. Bredesen's program, the rationale, the journey he's been through, studies published. He was the lead on several mainstream dementia research papers before he even went off the grid, I guess you'd say, but not really. He was just calling the truth as he saw it. As we all know, that gets smacked down sometimes. So here's his first book, which introduces you to the program. Second book, The End of Alzheimer's Program, tells you how to incorporate this into your lifestyle. And the third book is his actual research on the first patients who have recovered from Alzheimer's, personal stories. I'm going to turn it over to Guy now. Guy Odishaw is doing some amazing things with bioelectric medicine. He's been doing it for a very long time. We thought that this would be a perfect marriage of treatments. You do everything you can on the metabolic side, and then use the best and the most cutting edge technology to help revitalize and restore brain function. So I'll turn it over to you now, Guy.
All right, thank you, Dr. Sinda. Great job. Hard act to follow. And I'm Guy Odishaw, partner with Dr. Sinda in the Minnesota Brain Health Clinic. So tonight I'm going to cover neuroimaging, which is where we start folks in the program, and then a touch on neurofeedback. And I'm going to spend the bulk of my time talking about neuromodulation, which is really the better approach for treating the condition, as opposed to neurofeedback, which is a little bit more palliative. So I want to orient you here. You're looking at a picture of our neurofeedback lab. So a couple of things here. When we're doing a QEEG, person comes in, has a cap like that put on. Over here on the screen, what you're going to see when I hit the play button, you're going to see lines of EEG going along there. We have 19 channels of EEG. Now this person is actually doing a training. So you're going to see coming across the screen here in this box, there's going to be about 370 different brain metrics that are being trained simultaneously in the neurofeedback. Here, you're going to see how this person is doing compared to an age and gender matched normative database, where you're going to see bursts of color, kind of red and orange, where there's too much. You're going to see blues, where there's too little activity. On this screen, we're doing biofeedback. And so we're watching here muscle tension, temperature, skin conductivity, heart rate variability, blood pressure. Here we're looking at synchronization of the breathing rhythm and the cardiac rhythm. And then here we're looking at a BVP, or like an EKG, so looking at the heartbeat itself. So when we're doing this, we're doing a full 19-channel EEG, and then we're doing a 10-channel biofeedback at the same time. So we're collecting an immense amount of data. And up on this screen, you're going to see the actual neurofeedback process as the object kind of wobbles. That's feedback to the brain to say, oh, you're not quite doing it right. As the object flies straight, that's feedback to the brain to say, yes, keep doing what you're doing. So you see the flying surfboard creature when he missed the circle, and that is feedback to the brain saying, oh, you're starting to lose the plot, come back, there. Her brain was able to find its way back to what the computer is looking for in terms of how energy and information is being moved around specific networks in the brain. So that's part of both of the EEG process and the neurofeedback process. So we're going to take a little bit deeper dive into the actual functional neuroimaging as we look at two things in detail: the quantitative electroencephalograph, or QEEG, and event-related potentials, or ERP. So two kind of gold standards for looking at brain function. So here you see a summary of a QEEG. And what we tell people is these little head maps right here. So this is actually a little head. There's a nose and ears on there. These should be clear. Whenever there's color, there's a finding. Right? So you can see from this one, there's a lot of color. There's a lot of findings. This is kind of a classic Alzheimer dementia findings we have here, which is excess theta or slow wave, and then diminishing as we move into the faster bandwidths. You can see the blue is getting deeper. So this starts to look a lot like dementia. So as we go on here, we're looking at the brainwave frequencies from 1 hertz up to 40 hertz. And again, you can see a similar pattern as we go up into the faster, there's more and more blue, which is again a classic sign, and we'll learn a little bit more about this later on, of what happens in Alzheimer's and dementia. Again, as Dr. Sinda mentioned, the buildup of amyloid plaques, one of the ways we detect that through an EEG is buildup of amyloid plaques tends to block the gamma or the faster waves. Here's another metric we use. This is peak alpha frequency. It's very well understood. Again, what we should see here is no color in this little head map, but instead we see a lot of colors ranging from too slow to too fast. And this is a sign that the pace setter of the brain is off, or a thalamocortical dysrhythmia. And again, another indicator that things are not going well. Now this is moving into the ERP. And so we're looking at an event-related potential. So this line marks when this person received a stimulus to which they were to respond. So we can see here this larger amplitude is a group of neurons firing. And then here we see another big group of neurons firing. Now what we want to see ideally is right here at 300 to see the biggest activity right there. But what we see is some anticipatory activity and then delayed activity. So this is a sign that there's something a little bit off. So we look a little bit closer now. This person is actually doing really well. I was impressed when I saw the findings, but what we're looking for is right here. This is a pretty good indication, right? This is showing good synchronization, the right timing, the right brain waves. That's looking good. But if you look at some of these other ones, here, 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 you can see almost no activity. And we should see in all of these locations a pretty nice red line like that. Tells us that the neurons are locking. These areas are responding as anticipated. So we can see here where some of the information breakdown is happening. And this tells us later again where we would plan a treatment for. So this is an even deeper look into a specific region. This is called an ICA, or an independent component analysis. And this is telling us the brain waves that are happening there. And again, we see this really slow wave at about 6 hertz. So theta, we'd like that to be over at 10 in a healthy brain. We have some work to do. The question, what can we do about it? Well, that's what our clinic really focuses on after we collect the data, is creating an individual treatment program. So I want to go a little bit deeper into something Dr. Sinda shared around the amyloid plaques. We're going to do just a little bit of neuroanatomy to help us understand what's coming in the talk.
A human brain contains billions of neurons. Neurons are probably the more important and better known cells of the brain, as they carry out the brain's communication function. Less known are some trillions of support cells called glia, or glial cells. The glia may not be the center of attention, but without them, neuron functions would be impossible. The major types of glial cells in the brain include oligodendrocytes, microglia, and astrocytes. Oligodendrocytes are specialized cells with long processes that wrap around axons of neurons to form the myelin sheath. The myelin sheath acts like an electrical insulator around a wire. It helps to speed up the electrical signals that travel down an axon. Without oligodendrocytes, an action potential would propagate 30 times slower. Microglia are special macrophages found only in the central nervous system. They wander through the brain tissue, phagocytizing dead, injured cells and foreign invaders. High concentrations of microglia are an indication of infection, trauma, or stroke. Astrocytes are the most abundant and functionally diverse glia. These star-shaped glial cells provide supportive frameworks to hold neurons in place. They provide neurons with nutrients such as lactate. They also produce growth factors that promote neuron growth and synapse formation. It's been suggested that astrocytes can control how a neuron is built by directing where to make synapses or dendrites. Through their processes, known as perivascular feed, astrocytes induce endothelial cells of blood vessels to form tight junctions. These tight junctions are the basis of the blood-brain barrier that restricts the passage of certain substances from the bloodstream to the brain tissue. Astrocytes help to maintain the chemical composition of the extracellular fluid. They express membrane transporters for several neurotransmitters such as glutamate, ATP, and GABA, and help to remove them from synaptic spaces. Astrocytes also absorb potassium ions released by neurons at synapses. This helps to regulate potassium concentrations in the extracellular space. Abnormal accumulation of extracellular potassium is known to cause epileptic neuronal activity. Recently, it has been shown that astrocytes can also communicate electrically with neurons and modify the signals they send and receive. In a manner similar to neurons, astrocytes can release transmitters called gliotransmitters upon stimulation. This suggests that astrocytes may be involved directly in the communication functions of the brain.
The main thing there is to get a little bit of understanding of the importance of the supporting cells. Often we think a lot about the neurons and what's happening with the neurons, but the microglia are as important or more important. And we're going to just go a little bit deeper into some of the research here and learn about the activity of microglia and their relationship to brainwaves, in particular the gamma brainwave.
Now, it's been known for a number of years that neurons and glial cells release molecules that allow them to communicate with one another. But around 5 years ago, this paper came out in the journal Nature, which prompted the field to really start to rethink the mechanisms or processes that might underlie this communication between neurons and glia cells. And essentially what this paper showed was that in an Alzheimer's mouse model, they used artificial methods to boost the levels of these waves of electrical activity, these gamma oscillations in their brain. What they also showed was that the properties of their microglia cells, remember these are the sentinels of their brain that coordinate and direct these immune responses, they also changed. So the cells went from having this star-like resting appearance to this more amoeboid, Pac-Man-like appearance in which they can go around and chomp up pathological aggregates. And remarkably, what they also observed in this paper was that when they boosted gamma oscillations and caused the microglia to take on this particular form, the overall amount of amyloid plaques that formed within the brains of these model mice decreased quite dramatically. And so this suggests that leveraging communication between neurons and glia cells and restoring normal patterns of activity or normal patterns of communication between these cell types could hold a key to treating Alzheimer's disease. And so one way that this group has taken, or one approach that this group has taken to do this is by using sensory stimulation in the form of light and sound to try and boost gamma oscillations in the brains of people with dementia. And so here we can see a member of this original research team wearing a device that provides light and sound stimulation to boost these gamma waves within the brain. But one thing that particularly interests me and my group is that we don't have a good handle on the mechanisms that underlie this process. And perhaps if we understand the molecular mechanisms that mediate this process, we could also target it with drugs to boost this process in the brains of people with dementia and thereby take an approach to treating the disease. Now, one of the difficulties that we have in trying to understand the mechanisms that underlie this process is that it's very difficult to get access to the brains of either people with dementia or even animal models. And so one of the things that we've been doing over the past year and a half or so is to develop a model in which we can study the molecular mechanisms that underlie this communication between neurons and glial cells mediated by these rhythmic patterns of brain activity. And we do this using slices of brain tissue. And we can place electrodes in this brain tissue, and we can also image this brain tissue and then use drugs to try and change the patterns of activity or block certain processes to understand how this works. And so one of the things that we observe in our model is that when there's an absence of this rhythmic brain activity, which is shown here, so this is a trace or a recording of electrical activity in this slice of brain tissue. What we see is that our microglia cells have this star-like resting appearance. So they're not in this sort of inflammatory state that can facilitate the clearance of protein-based pathologies. But what happens when we instate these rhythmic patterns of brain activity, these gamma oscillations in our brain slice, and so that's illustrated by this repeated pattern of oscillatory activity in our electrical trace. What we see is that our microglia change their appearance, so they take on this amoeboid-like morphology, and it therefore puts them in a state in which they're better able to engulf pathological protein-based deposits.
So I'm often asked if there is research supporting the methodology that we use. So I always like to show at least a little example that there is an immense body of research, very high level of body of research, very specific, to show both in vitro and in vivo, in the lab and in human trials, that these technologies that we're going to look at actually work. So we're going to touch briefly on neurofeedback in the clinic and at home, neuromodulation in the clinic and at home. And I'm very much an advocate for home-based treatment as much as possible, so that the only people who end up receiving treatment in the clinic are the people who need clinic-based treatment. But at home is certainly more affordable, it's more convenient, and more effective is difficult to say. I would say that the part that increases efficacy for home-based treatment is a person can do it once a day, twice a day, 3 times a day, where it's just not practical to come into the clinic that frequently. So although we may have more sophisticated equipment in the clinic, a person has more access to these home-based devices, which again makes it easier, and we do find that the outcomes are quite effective. So the first one I want to talk about is the audiovisual entrainment, and you'll notice that he indicated in the video part of their research group was using this particular device, the David Delight. They now have a program on it that has the gamma frequencies, so that we can try and parallel the research that's been shown that gamma is particularly effective at this, although there is a large body of research to show that other frequencies have similar and in some ways better outcomes than the gamma, but the gamma is getting much of the research-based attention right now. The gamma has been added to the device. But the main things that it does is it's going to increase cerebral blood flow. It increases the synchronization of brain activity and the size of the pools of neurons, like how many neurons are firing when called on. And those three things, the blood flow, the synchrony, and the restoration of the thalamocortical loop, or the timing mechanism, those are all very important relative to what Dr. Sinda mentioned about the buildup of amyloid plaque as kind of a root cause. These three changes brought about by the audiovisual entrainment are a direct address to clearing amyloid. Right? And then we have balancing neurotransmitters and exciting the microglia and astrocytes, which again, we just talked about the beneficial side of that for maintaining the healthy environment in the brain and maintaining healthy neurons and creating myelin to keep neurons myelinated and clearing away the debris that can lead to plaques and tangles. It's a simple device. I like to think of it, many of these things I like to think of it in just a simple way as like the same way you would think about nutrition or exercise. They're highly impactful when done on a regular basis over time, right? So in terms of, how long does it take a person to reach a diagnosis of dementia? 15 to 20 years of a slow process taking place in the background that eventually hits a tipping point, and then we see the onset of the disease with the recognized hallmarks of plaques and tangles or vascular dementia, where there's a change in the functioning of the blood vessels. So it takes a lot of time to get there. We tend to like to think about medical interventions having a very rapid impact. So, people will try and the audiovisual entrainment, and after a week say, I don't think it's working. Well, we're working on a larger time scale here to be able to begin the process of reversing 15 years of suboptimal change in the brain. So we have to allow these things to have some time, but there are no side effects to any of these. So they're safe, they're cost effective, they're pretty low impact on one's lifestyle. So pretty easy to integrate into the daily activity. So here, transcranial stimulation. There's a number of devices on the market that can do this. The one here shown is, again, another of the Mind Alive products. AlphaStim is a perfectly good choice in this regard. A number of products coming on the market just because transcranial stimulation is showing to be effective. People are becoming more accustomed to doing it, so we see a better uptake by consumers. So here, probably the number one benefit to transcranial stimulation is this idea of normalizing the resting membrane potential of neurons. Right? What does that mean? If you have neurons that are overfiring, this will help settle them down. If you have neurons that are underfiring, this will help bring them up. And as we looked at going through the EEG maps, we see a lot of blue in brains of folks who are moving towards mild cognitive decline into dementia. And that's underactive neurons. So transcranial stimulation is a great way to kind of literally charge the brain. It's like a trickle charge to the brain to help create more electrical activity. Again, activating microglia and astrocytes, increasing cerebral blood flow, and it has a pretty profound effect on mood, which is great for both the person who is struggling with the condition, but also for the people around them, right? Many of these treatments, although good for the patient, are actually also really good for the support team of the patient. And it's good to keep both in mind from a treatment standpoint. We use the Muse S EEG tracker to do at-home sleep studies. As Dr. Sinda mentioned, sleep is really important for brain health. And we find that many of the folks who come in and are complaining of symptoms, that sleep has been an issue for a while and may still be an issue. So the ability to do an at-home sleep study where we're tracking EEG, so we're getting brain activity, that can be done, not one time, like if you go in for a sleep study, you get one. Here, we like to capture a week or two of sleep so we can see trends. This also allows us to monitor how treatment is doing. So if we're making interventions into a person's sleep, we can see what part of the sleep cycle we're changing, how much we're changing it. And these can be really difficult for people to tell in the beginning. You know, it's challenging to know if I got an extra 10 minutes of deep sleep last week. Right? But by using a tracker, we're able to tell that, and it gives us the early signs that we're on the right track in terms of changing diet, lifestyle, sleep hygiene, other things that we may need to do to improve sleep. The other thing that is great about the Muse S, for those who want to, they can use it to do at-home neurofeedback training. So it's a fairly simple form of neurofeedback training, but it's effective. So it's a nice way to use the device for more than just sleep tracking, to also do some brain training. Next, we get into the area of photobiomodulation. It's one of the areas in the bioelectric world that's probably getting the most attention right now. The recent research has been just showing incredible results. And it's one of the few places where I'm seeing research really, map onto the clinic. And we're seeing the kind of results in the clinic when we use photobiomodulation that the research indicates. And I have to say, unfortunately, that's rarely true, that you get such good translation from research to the clinic. Two of my favorite devices here, the nasal laser and the infrared helmet. Very different ends of the cost spectrum. Nasal laser, maybe you're looking at about $175 for a good one. The helmet, you're looking at about $3,000. It's really about significance of the intervention, right? The nasal laser is a very small input. It's effective if used daily over time. So 30 minutes a day, every day, begin to see change. With the helmet, the amount of power, and there's applied directly to the brain, you're looking at maybe 2 6-minute treatments a day and beginning to see the effects of that come along sooner than you would with the nasal laser. But there are also wraps, bulbs, panels available. If one was to go on Amazon and just look for red light therapy, you would find thousands of devices. The problem is the consumer doesn't know which of those devices actually deliver a medicinal dose and which ones don't. And if you don't have enough what's called power density, if your device can't deliver enough power density, it doesn't matter how long you use it for, it won't trigger the metabolic change you're looking for, and therefore it'll have no effect. Looking for a device that has the proper power density and is convenient to use, I would say those are the two most important factors. Again, it could be a great device, but if it's too awkward to use and you don't use it, then it's not going to be helpful. So that's how I work with my clients, is really to find the device that fits their condition and fits their lifestyle so that they use it. We can see here, what are the benefits of photobiomodulation: helping to regrow nerves, helping to regrow synapses, helping to regrow blood vessels, again, an increase in cerebral blood flow. Maybe one of the most important things is its ability to increase mitochondrial activity. And again, we see when we look in the dementia research, this is one of the areas that gets a lot of attention, is the decrease in mitochondria themselves and the decrease in mitochondrial function, which is mitochondria produce the energy. And so if there isn't the energy there to drive the cellular activity, metabolism slows down. And then we get the buildup of toxins and waste material, which can start the cascade of moving towards an inflammatory condition and towards Alzheimer's and dementia. Increasing mitochondrial activity, huge impact on brain health. Again, the next is anti-inflammatory. It has a very strong anti-inflammatory effect, and activating microglia and astrocytes, and then the possibility of activating stem cells, which again can be incredibly helpful in regenerative medicine. So a lot of being offered through photobiomodulation, and again, it's safe, it's easy, and it's highly effective. We're going to listen to Dr. Hamlin tell us a little bit about this And Dr. Hamlin is one of the world's foremost authorities on photobiomodulation, 40 years of research. I thought it'd be best to hear from him.
Hello, everybody. My name is Mike Hamlin. I'm giving the keynote address here, which is the history and mechanisms of photobiomodulation, with a focus on the treatment of brain disorders. From Blue Limb, Toronto, and Canada, a small clinical trial for Alzheimer's. So this is LEDs that are positioned on particular parts of the head to interact with the default mode network. And here you see that it was started off to be a randomized trial, but what they found was that all the patients in the placebo group didn't improve and they dropped out. So only the patients getting the real photobiomodulation stayed in the trial, and they had a big improvement in the two scores that they use for Alzheimer's, the mini mental state exam and the ADS COG score. Treated, I think, 3 times a week for 12 weeks, a big improvement. When they stop the treatment, they actually get worse. See, they get a bit worse. But then the patients were given a compassionate device to use at home, and amazingly enough, they all got better again. So basically, Alzheimer's and dementia, it's going to be a lifelong therapy. So you can show good improvements after some weeks. You're probably going to have to keep using it forever, but in a trial, that's difficult to study. But this was a big improvement. This was many times bigger than the improvement seen with the best drugs for Alzheimer's disease, which are not very good drugs. This was a study from Farzad in Iran, who had 3 kinds of PBM, red and near-infrared, light helmet, a body pad, and an intranasal device. Again, 10 hertz pulsed wave, in fact also, 25 minutes per session. See them. And single patient, but he got a lot better. So it's quite big jumps in various cognitive tests. 15, 22, these are big differences. Interestingly, if you have Alzheimer's disease, your sense of smell goes, and if you get photobiomodulation, the sense of smell comes back. So that kind of shows that the neuroprogenitor cells are fixing things in the brain, because the sense of smell is highly dependent on brain repair. Parkinson's disease, this was work from Australia, where they have these light helmets. These light helmets on the head. All wavelengths, red, near infrared. What you see is that color is green for these measurements that you can, because everybody's symptoms are different in Parkinson's. That makes it a bit difficult to really do a trial. But anyway, problems they had at the beginning were either no change or improved. Nobody symptoms got worse, any of them. The vast majority improved after, I think this is 4 weeks treatment, I believe. Twice daily, 20 to 30 minutes. So this is now back to healthy adults. There were older adults, but everybody, as you get older, your cognitive function suffers a little bit of a decline, unfortunately, in memory and your sort of reaction time and what have you. And the big change here was in the category fluence test. So this is when you're asked to do things like name as many animals beginning with B as you can in 30 seconds or something. And the ones that had the photobiomodulation could name 3 times as many things in the category, which is a big change, actually. Another study from Agnes these are people with mild cognitive impairment, so older folks, but they're just on the sort of verge of developing dementia or Alzheimer's or what have you. So their memory's going, basically, but the ones that got the light did a lot better in visual memory than verbal memory. This one, but most of their memory was a lot better. 18 sessions of PBM twice a week for 9 weeks. There's a lot of common pathways in neurodegenerative and psychiatric diseases. Neuroinflammation, oxidative stress, cytotoxicity, mitochondrial dysfunction, neuronal apoptosis, low BDNF, impaired neurogenesis, impaired synaptogenesis. In the end stage, the hippocampus shrinks, and really end stage, the whole cortex shrinks. And all these brain conditions can eventually lead to big problems with the brain. So being able to benefit BDNF, neurogenesis, synaptogenesis, all these things over here can help a lot with brain disorders. Classify them into traumatic, so there's stroke, TBI, but if you have a heart attack, the supply of blood to your brain can be halted, get brain damage. As I say, the birth trauma, we talked about that, people in a coma. A lot of psychiatric disorders, depression, suicide, anxiety, PTSD, addiction, insomnia, people have shown all of these can be benefited. A lot of neurodegenerative diseases, not just Alzheimer's and Parkinson's, but ALS, various kinds of dementia, CTE, which you get, sports players get when they have head impacts, Creutzfeldt-Jakob, Huntington's disease, even neurodevelopmental disorders such as autism and ADHD. People are starting to treat these with photobiomodulation to the head. We published a book recently, Photobiomodulation in the Brain, which has got quite a lot of chapters from all the folks working in this field. So the conclusions, photobiomodulation is a history of over 100 years. The mechanisms of PBM are becoming understood. And a lot of animal studies of TBI and other brain disorders. And a lot of investigators have done clinical studies, acute and chronic TBI, Alzheimer's, depression, opioid addiction.
All right, thank you, Dr. Hamlin. And I want to say thank you for joining us for this presentation. Dr. Sinda and I will be doing a live question and answer in the weeks ahead, and following that in the new year with a live event presentation. Hope to see you there. Thank you.